Welcome on stage.
Thank you very much, Mr. Chairman. And thank you so much to the Malaysian Palm Oil Council and Dr. Sundram for inviting me here to Malaysia and to participate in this very exciting conference. I was telling some of my colleagues that it's just incredible to be surrounded by such brilliant minds. You folks that are doing research on the bioactives in palm, sharing and elucidating information as to their neuroprotective benefits, immune modulating effects, cancer protection, bone health, skin health. It's really fascinating, and I'm so grateful for the opportunity to be here to learn from you and to take this information back to Canada and North America and to share that information with my patients that I work with in the pharmacy and also through the media. So my perspective, and what I would like to do today, is to share with you my perspective as a pharmacist, someone who's on the front lines providing patient care, and also as someone who takes the information that I learn about through your research and convey that to consumers through the media. And I thought I would start by giving you a little bit of my background in terms of how I became interested and pursued a career in holistic natural medicine. And I transitioned. I went to a mainstream pharmacy school. I went to the Philadelphia College of Pharmacy and Science. But my interest in natural medicine actually stemmed from an experience that I went through when I was a young girl. And I suffered for many years as a young girl with some pretty horrible physical and emotional symptoms. I had terrible gastrointestinal problems, which I won't go into in detail. I had terrible headaches. I lost a lot of weight. I suffered with anemia, skin rashes, joint pain, muscle pain, and just a very, very poor state of health. And during that time, which was about over 10 years, I was sent from doctor to doctor, and I was given a series of prescription medications, none of which worked for me. And after pursuing it, my parents took me around the country trying to find out what was wrong with me. They discovered that I actually had celiac disease, which is an autoimmune disease triggered by the consumption of gluten. And gluten, as a teenager, gluten was a staple in my diet. It was pizza, it was burgers and cookies, and I wasn't the health-conscious person that I am today. And little did I know that the foods that were a big part of my diet were actually poisoning my body. And all of the symptoms that I was experiencing as a young girl were actually tied to deficiencies of vitamins and minerals and essential fatty acids. So as a young teenager, that really, a light went off in my head just with respect to how important nutrition is for health and well-being, and what happens to the body if we're not given the right nutrients. I think a lot of kids, and a lot of teenagers in particular, they don't pay attention to what they eat in their diets. They eat what's popular, what tastes good, and we really don't think a lot about how that nutrition impacts their health. But for me, because of that experience that I went through, it caused me to be very in tune with my body, in tune with how important nutrition was. And it really wasn't until I started taking supplements in therapeutic dosages and following a very strict gluten-free diet that I was able to restore my health. And I went on several years later to study pharmacy, and I went to the University of Sciences, the Philadelphia College of Pharmacy and Science, and I acquired a great knowledge about pharmaceuticals and how we can use drugs to treat diseases. And that was wonderful, but I knew in the back of my mind that drugs are really only going to get us so far. And not a lot of attention was spent at that time, and I went to school in the mid-'80s, with respect to how nutrition can be used therapeutically and how supplements can be used therapeutically. So when I finished my studies in Philadelphia, I went on to study natural medicine and nutrition, and I incorporated that into the way I practiced. It was very rewarding. I didn't really feel satisfied just doling out prescription drugs and seeing people get sicker, develop side effects, and really lose charge of their health. So what I did is I took time to talk to my patients about how important nutrition was for their health and well-being, exercise, stress management, and all of these different things. And it was really rewarding. I got to the point where I worked with a group of 10 doctors in a medical office, and when I first started practicing this way, there was a lot of skepticism. Some of the doctors were raising their eyebrows. I don't know about this. There's no science on these natural products. And really to overcome that, what I did is instead of having just continuing education events on drugs, which most of the doctors I worked with, they said, this is where we get our information after school. We attend continuing education, and it's given to us by the pharmaceutical industry. So we would hold roundtable discussions and continuing education events where we looked at some of the research papers on natural medicine, and it helped to open their minds up as well with respect to the possibilities and how natural products can be used therapeutically. And so it was a really rewarding experience, and not just for myself, but also for my patients and the doctors that I practiced with. You know, it's interesting when we look at how medicine has really gone full circle from the days of the medicine man and the focus on using plants and natural products as medicines, which they've been around for thousands and thousands of years and embraced by many areas across the globe, to the pharmaceutical revolution, where all of these incredible pharmaceuticals were developed in the late 19th and early 20th century, and we started using penicillin and codeine and aspirin and all of these drugs, and some of the natural products started to fall out of interest in favor of some of the pharmaceuticals. But now we've almost gone full circle, where we have this renewed interest and enthusiasm and excitement and passion in using natural products, vitamins, minerals, antioxidants, and dietary supplements to help improve and to treat and to manage different health conditions. From a pictorial perspective, this is what the pharmacy looked like back when I first started practicing over 20 years ago. We had a very small section of dietary supplements. It was 4 feet. It had your letter vitamins, your A, B, C, D. We had some cod liver oil, fish oil hadn't really taken off to a large extent. It was a very small section of the pharmacy. Now today, if you look at most pharmacies in North America, and I'm sure in many areas of the world, there is complete aisles of dietary supplements, and there are actually pharmacies that specialize just in dietary supplements. And it's just interesting how the use and the acceptance and the availability of supplements has so dramatically risen over the past few decades. But this has all been fueled by research. Research has driven consumer interest, and consumer interest in using these natural products has driven even the mainstream medical acceptance of these products. Because without the science, these products don't have the credibility, and without the science, they don't have the acceptance among healthcare professionals. So what we've seen is really it's a paradigm shift with respect to how doctors and pharmacists approach disease states, but also in terms of how patients approach their own health. There's an increased awareness of the role of nutrition and lifestyle. We know that the cause of disease is multifactorial. Look at the main conditions that affect people today: heart disease, diabetes, and cancer. We don't have one single solution. The best outcomes are going to be achieved when we can offer our patients a multidimensional approach to health, where we can help them maybe with pharmaceuticals along with natural products and mind-body medicine and stress management and exercise and nutritional strategies. That's really going to give us the best outcome for our patients. There's a much greater emphasis today on prevention. I see that when I'm talking to patients in the pharmacy, they're no longer satisfied with just taking a prescription pill to fix their problems. They want to know what else they can do. Patients today are much more informed than they were when I started practicing over 20 years ago. And if we take it back even further, I remember hearing from some of my older colleagues back in the early days of pharmacy, doctors would write prescriptions in Latin, and that was so that the patient couldn't read what was on the prescription. And when that prescription came to the pharmacist, we would just put instructions on the bottle: take 1 pill twice a day. We didn't tell the patient what drug they were getting. We didn't talk about the side effects, the interactions. It's just so different today with respect to how we approach even pharmaceuticals, and how today there's a great emphasis on educating the patient. Pharmacists are no longer just doling out prescription pills. A lot of what we do is educate patients on how to use these products appropriately, whether there's side effects, how to take them best to avoid problems and interactions. And there truly is a renewed interest in natural medicine. We see more and more pharmacists that are practicing this way. We're using the two as an integrative. So we see that natural products using vitamins and supplements, dietary supplements, it's no longer seen as alternative. It's part of the mainstream, and it's part of this integrative and complementary approach to health. So when we take a look at, this is a recent, results of a recent survey. This is from the National Health and Nutrition Examination Survey. It's a population-based survey that looked at over 11,000 adults, and they were asking people about whether they took supplements, and if so, why did they take them. And this is actually one of the first times a national survey has been done like this in the United States. And what they found is that over 50% of adults are taking one or more dietary supplements on a regular basis. In Canada, the most recent survey has found that it's actually about 70% of Canadians are taking dietary supplements on a regular basis. And interestingly, these are people that tend to be healthier. These are people that are more tuned into their bodies. They are active. They have a healthier body mass index. They're not heavy alcohol users or more moderate alcohol users or non-smokers. So they tend to be people that are very health conscious and want to do what they can to improve their health. The three most commonly used categories of supplements are multivitamins, fish oil, and calcium products. And when they asked people, why do you take supplements, people were most often saying it's because they wanted to improve or maintain health. We know that it's a lot easier and more affordable to prevent disease than it is to deal with diseases after they occur. And I think people are getting that message, and they feel empowered, and they want to do what they can to reduce their risk of having to take medications later on in life. People are also taking supplements because of specific interests. Maybe they have high blood pressure, high cholesterol. They want to take supplements to protect their vision as they age. They want to take joint health supplements, and they're concerned about the side effects with the prescription drugs. What was interesting is that less than a quarter of the dietary supplements used by these adults were recommended by a physician or healthcare provider. It was around 23–24%. That's still up compared to surveys done previously, but it just shows you that this still hasn't gained complete acceptance among mainstream medicine. Now, some of the other driving factors for taking natural products and dietary supplements, I think fear of prescription drugs of pharmaceuticals is a big force. And in the United States, where drug companies are allowed to market directly to consumers through television ads, people are watching those ads and they're hearing that they can develop liver failure, kidney disease, black hairy tongue, sudden death. And that they come into the pharmacy and they're like, I heard this about this drug that I'm taking. And so now they're starting to ask questions more so about these drugs and these side effects. And they're concerned about high drug costs as well, particularly in the United States, where drug costs are often unmanageable. And so they see using dietary supplements as a more affordable option. And there's also a desire to go natural. There's some people, just due to their background, certainly people have a background in Europe or in Asia, where these are more part of the mainstream. These natural products are used more commonly. And there's a perception, I think, among patients, too, that dietary supplements have a greater safety profile. And while there can be interactions, there can be side effects, by and large, a lot of these natural products are very well tolerated. Now, there's another survey that just came out in February this year, and this was done by Consumer Lab, which is an organization that reviews quality and claims of dietary supplements that are on the market, and they also do some market research. And they polled, I believe it was 10,000 of their people that were subscribed to their newsletters and their surveys. And what they were looking at is what are some of the most common supplements that people take, and where are they buying their supplements. Not surprising, fish oils really top the list. And these are people that are already taking supplements. This is not just the general population. Fish oils were most popular, followed by multivitamins, vitamin D, coenzyme Q10, calcium, B vitamins, and vitamin C. So these are products you can see that are foundation supplements. These are products that people take on a regular basis to prevent, to improve their health. And interestingly, some of the categories that had the greatest growth are some that are getting a lot of positive press and a lot of research right now, in particular probiotics, where there's just been a ton of research been going on in the last few decades with probiotics. But also coenzyme Q10, people taking that for heart health, for gum health, for anti-aging. The whole anti-aging category of supplements is very big. It's continuing to just really boom and expand. Now, this was surprising to me when they looked at where these people are buying their supplements. almost half of these respondents said that they purchased some of their supplements online. And I think the reason why people purchase supplements online is it's easy, but also they're shopping for prices. The concern that I always have as a pharmacist, if they're not coming into a pharmacy or to a healthcare center where they're going to get some proper advice, is that they may not be understanding how to take these products appropriately. Are they safe to take with their prescription medication? And that's where sometimes patients can run into trouble. So most often I find when I'm talking to patients, if we're doing medication reviews, I'll ask them to bring in all of their drugs, their supplements. They bring in their shopping bag. We sit down, we go through it, and sometimes people are surprised to realize that they're taking duplicate products. Maybe they can cut down on what they're taking. Maybe they're spending too much. They can find better ways just to save some money with respect to their supplement program. Now, given the nature of this audience, I'll speak just briefly about the carotenoid market and also the market for tocotrienols. Really at opposite ends of the spectrum, the carotenoid market quite well established, quite a large market, and the tocotrienols really in their infancy. And when you talk to patients about carotenoids, I think most have a fairly good understanding about the benefits of carotenoids. Beta-carotene is a name that people understand. It resonates with eye health, with skin health, with heart health. There's pretty good awareness with respect to beta-carotene and some of the other carotenoids like lutein and lycopene. The cosmeceutical market has really been one of the driving factors for growth in this market, as we're seeing more and more patients that are looking for that fountain of youth. They're looking for products that they can put on their skin or to take orally that are going to fight UV damage, to improve the health and the look of their skin. They're interested in finding more affordable ways to cosmetic surgery, and we're seeing a large growth in this area with respect to companies making dietary supplements or face creams or products that have some of these antioxidant carotenoids added into the formulas. The global market for carotenoids is estimated to be at about, over $1.2 billion. That was in 2010. And it's enjoyed a lot of growth just over the past 5 years, 54% increase just in the last 5 years alone. Beta-carotene, not surprisingly, leads the pack with about a 22% market share, followed by lutein and lycopene and some of the other carotenoids. Now, tocotrienols, they've been deemed to be the next generation of vitamin E, the new super antioxidant. And really, this is a category in its infancy. When I talk to patients about, for example, if I just say vitamin E, most people think of alpha tocopherol. They don't understand that there's 4 tocopherols and 4 tocotrienols and that they have all these unique and distinct properties. So when I've talked to patients about the palm oil bioactives and the tocotrienols, I can see that this is really an area that is truly in its infancy. A lot more work has to be done with respect to educating, and that's why I try to share that message about the benefits of tocotrienols. I take some information from the research that you do, I bring that home and I share it with my patients, not just talking to them in the aisles of the pharmacy, but also through the messages that I get out in the consumer media. And I think there really is an opportunity there, and certainly it's exciting to look at the possibilities of where the tocotrienol market is going to be in 5 or 10 years from now, when we look at just the incredible research that's being done all over the world on this category of supplements. It's fascinating, and I think the possibilities are very, very exciting. Now, one of the hurdles that we have to overcome with respect to the dietary supplement market really is overcoming some of the confusion that consumers still have today. They hear some mixed messages. I think a lot of folks, when it comes to oils, for example, they understand that fish oil is good, that olive oil is good for their health. But if I say palm fruit oil, they're like, palm oil? I thought that that was higher in saturated fat. I thought that that wasn't a healthy oil. So I try to work through my writing and through my work in the pharmacy and again in the media to help educate them and overcome some of these misconceptions with respect to palm fruit oil. People are often excited when they hear that this oil, not only is it good for you, but you can cook with it, it's heat stable, has a high smoke point, has all of these nutritive benefits. So we really work, as an integrative pharmacist, I try to work and educate people on some of the unique benefits of palm fruit oil and some of the other things that we have in the pharmacy. And not just with the confusion, clearing up the confusion with the palm oil. And but also the whole vitamin E, because I think for a lot of people, they still have in the back of their mind, they heard media reports that vitamin E is not good for their heart. And so I think that a lot has to be done with respect to educating people about some of the research that was done on vitamin E, what it really found, and what the differences are with the tocotrienols and the tocotrienol research that's coming out. Now, I was really introduced to Malaysian palm fruit oil through Mike Danielson and his team at Media Relations when I was researching and writing my book, Saving Women's Hearts. And my co-author for this book is Dr. Martha Galati, and she's based at Ohio State University, where Dr. Sen does his amazing research as well. And I found it fascinating to learn about the benefits of palm fruit oil and the bioactives in palm oil, the tocotrienols. And so it came at a perfect time, because with my book, Saving Women's Hearts, I was really trying to help educate women about heart disease, given it's their #1 health threat. Still, a lot of women fear breast cancer as their big health threat, but heart disease claims more lives than all forms of cancer combined. And when I was doing working on the manuscript for Saving Women's Hearts, I really wanted to devote a section of my book to the power of natural medicine, to the role of dietary supplements. I have a section called Nature's Pharmacy, and I have a section where I also wrote about some of the nutritional controversies, and I included a discussion about palm oil. And it's been very well received by consumers and the media. People are very interested in learning more about palm oil and the tocotrienols. And through my work in the pharmacy, certainly I can reach 20 or 50, maybe 100 patients a day. But when Mike Danielson and his team at Media Relations, they've been able to hook up media interviews through me across North America, where I've been able to share that message with 10 to 15 million consumers. So we're really able to get into people's homes, to educate them on the benefits of Malaysian palm fruit oil, the unique research that's being done. And it's my hope that after this conference and all that I've learned through my experience being here, that I can continue to help educate consumers on the benefits of these exciting bioactives that are found in palm fruit oil. This just shows you some of the various clips from different appearances that I've had in North America. So I'd like to say thank you. My presentation, I know, is brief, but I really just wanted to give you some of my perspective as a pharmacist, again, on the front lines providing patient care, what's happening with respect to dietary supplement use, and to thank the amazing researchers. I apologize I don't have all of your pictures up there. There are so many people that are involved in doing just incredible research, but I want to thank you and encourage you to do more research. I will take that information and try and convey that information to consumers so I can help increase consumer awareness and put that information into practice as I deliver patient care. Thank you very much.
Thank you very much, Sherry, for your very informative presentation. I would like to open the floor for a question. If none, I will start, if you don't mind. As a pharmacist, you know, my point of view is prevention is better than cure, and I see that that should be the line even for you, but we are biased, or is really like that?
Yeah, I think I've always believed that prevention is so critical, and it's ironic because as pharmacists, people often associate just pharmacist, drug, treatment, and I know in North America, pharmacists are playing a much stronger role with respect to prevention and educating patients on prevention. One area which is really unfortunate is, I'm not sure how it is in other areas, but I know in North America, from a compensation perspective, pharmacists are paid to fill prescriptions. So I know when I first started practicing with natural medicine, the guy that I worked for that owned the pharmacy, he's like, how's this going to affect our bottom line when you're, getting people lower dosages of medication, you're getting them off of these medication? But I said, well, then they're going to buy their supplements in the pharmacy because we're expanding our area of supplements. And in the pharmacy that I practiced in, it was a small 1,200 square foot pharmacy. And when I first started, we literally had a 4-foot section of supplements. By the time, 10 years later, after I developed this natural practice, we had about 50% of our floor space devoted to supplements and increased patient volume, increased patient sales with respect. to the bottom line.
Supplements is the way to go.
You know, I take my Tocotrienols. I was telling Dr. Sundram on the plane over here, you know, it's part of my supplemental regimen. I believe that supplements have an important role in health and prevention and wellness. And I think that we just need to be very careful of how we use pharmaceuticals. And I always tell my patients that sometimes we need prescription drugs. We need, you know, if you have an acute episode of, we've had a heart attack or a stroke or something like that, yes, you're going to probably need some pharmaceuticals, but stroke is a good example. If you'd been taking your Tocotrienols and you have, you know, the Tocotrienols in your system, you might have less damage to your brain after a stroke. And I try to get people before they have that episode. Certainly some people are more motivated after they've had the stroke or the heart attack or they've been diagnosed with diabetes, but I really try to work with them to say, hey, you're at risk. This could happen to you next week, next month. Let's be proactive. Let's clean up your diet. Let's clean up your lifestyle and get you on some supplements and see what we can do.
Thank you very, very much.
Thank you.
Any
Thank
more
you very
questions?
much.
Please.
So, excellent talk.
Thank you.
I also take my Tocotrienols. We've heard about the whole idea about radiation and protection from that today. I'll tell you, being 30,000 feet up, flying over for a good 16 hours, theoretically, as we all know, being that high up, it's equivalent of a chest X-ray. Perhaps it's doing something. My question is this, though. And this is all going to be conjecture. I know it's all going to be your opinion. We've heard a lot of questioning around where Tocotrienols and or extracts from red palm fruit oil will end up, you know, once we've really established, perhaps 3, 4, 5 years from now, solid evidence, particular cardiovascular applications. In your opinion, as a pharmacist working with both natural health products and drugs, where do you imagine this going? Is it going to be a drug? Is it going to be a nutraceutical?
Well, yeah, it's interesting because when you look at how the Tocotrienols work in the body, they have drug-like effects, very powerful drug-like effects. But the problem is if they become pharmaceutical and prescription, then sometimes the costs become prohibitive and consumers lose access. So I hope that they stay as dietary supplements, but I hope we get to the point where doctors and pharmacists are routinely recommending them for prevention. I think we're going to see something similarly to what we've seen with fish oils, which 20 years ago, you know, people knew about cod liver oil, and there was just a little bit of research being done on fish oils. And now today, we understand that they can have some strong pharmacologic effects, and we have prescription-grade fish oil. I think we have some really good quality tocotrienol products on the market, Caratech, and I've had an opportunity to look at their science and their products, and I think that this is an area that is just going to expand tremendously, but I hope that it stays within the consumer reach from a cost perspective and also just availability. And I should mention, I've had a chance, you know, there are a lot of different food products out there, and I don't know if the folks that work with Nutella and the Smart Balance and the Keratina oil, that not only have I showed your products in the media, but I use them myself. I recommend them, and I'm just really, really happy to have that experience.
Who doesn't eat Nutella?
Yeah, the Nutella's great. You know, when I talk to people, I have Nutella on the TV set, and people are like, so that's good for me? And I say, yes, it's got the palm fruit oil, it has hazelnut, it has dark chocolate. They're like, great. They always like it when they can justify something that they truly like as healthy.